Hello and welcome to another episode of Every Possible Angle. I'm very excited for today's guest. We have Lynda Lee Smith. She is the CEO of Enduring Hearts. Lynda, welcome to the show.
Thank you, Michael. It's a pleasure to be with you.
We're really excited. Enduring Hearts does incredible work in terms of pediatric research and heart transplantation. It's really made an incredible impact in the community. But before we get into that, can you tell me a little bit about how you got involved with heart transplantation in the first place?
Yeah, absolutely. So I've had a long career, a very fortunate career, and I like to say impacting lives in a variety of different ways. I've spent almost 28 to almost 30 years. I don't like to talk about the years because it dates me, but in primarily nonprofit, but also for profit as well. But everything from housing, global housing epidemic to American Heart Association, American Cancer Society, international advocacy for children without parental care. I mean, just a broad, diverse range of different missions. But all of those compounded, have just given me a lot of insights into issues around the world and the work that charitable organizations do and the role that they serve. So when I had the opportunity to come to Enduring Hearts and bring that experience to this organization, it was an honor. For me, and I sort of felt like I was returning home because I had worked for the American Heart Association for so long and rolling out a lot of their national initiatives. So it's been a pleasure to be here. This is the Enduring Hearts is the only national organization solely focused on pediatric heart transplant research. And, it's hard to imagine we're only 12 years old this month, but 12 years ago, doctors, surgeons were really operating blind. I hate to say that, but I've talked to a lot of them personally, and they really had to learn from their own experiences. There wasn't a big opportunity for shared knowledge. There wasn't any research going on to speak of. And so we have, in fact, in the last 12 years, changed the environment for pediatric heart transplant research. And we're very proud of that.
It's incredible. It's incredible work. Can you tell me a little bit about how Enduring Hearts got started in terms of this journey?
Yeah, so our founder had taken their daughter to the happiest place on earth
Hmm.
at the Magic Kingdom in Disney. And, at the early age of 4, she started having respiratory issues, and they didn't, I mean, it's out of the blue. This is very typical. And, within 24 hours, she was in a coma at the hospital, and they were being told that most likely the solution to her heart failure was going to be a heart transplant. Of course, they had never done any research themselves on this issue, had no reason to. And like many other families, were caught completely off guard. Um, and the father happens to come from the technology industry and, started doing research and realized there was no research. And so, going through that journey with his daughter, he talked to a lot of different physicians, including her surgeons, who said, if you really want to do something, to change the future of pediatric heart transplantation and to extend the lives of these children and the quality of life, we need an organization who's solely focused on research. So fortunately, he put that, you know, he really took that seriously and he made it happen along with several others, his friends and others who joined in. We'll talk more about that later, but that's when Enduring Hearts was born. And today his daughter is 16 years old. She's a big, long distance runner. She's an athlete and doing very well.
Oh, that's incredible. What a wonderful story and way to turn such a challenge into something positive.
Mm-hmm.
That's so incredible and inspiring. And since 2013, Enduring Hearts has now invested over $11 million into 72 national and international research studies with 43 institutions. That's incredible. How
Yes.
are those innovations being brought about, and how do you approach making such an impact on pediatric heart research?
Well, we're very fortunate that we have an amazing scientific advisory council made up of over 20 individuals across the country and around the world who are experts in their fields. And they really are the ones who come together throughout the year and identify our research priorities. This year, our 2025 research priorities, we have three. One is to improve the longevity and the quality of life for post heart transplant. The number two is to identify and develop pre transplant strategies, which means innovation and new technologies. And the third one is to validate and implement evidence based strategies to improve the longevity and transition for pediatric heart transplant patients to adult care, which is a really big challenge. Um, so those 20 individuals who are all volunteers actually come together, look at the environment, look at what's happening in the field of pediatric heart transplant, and decide if our priorities are spot on. Do they need to be changed? And so, those 72 research grants that we've funded to date, almost $12 million, are all a result of this group reviewing letters of intent from investigators across the country and around the world and determining which ones they feel have the most opportunity for significant outcomes.
Oh, that's incredible, and it's so critical. I think in research in general, in medical research, it's such a challenge for transplantation in general because it's a small field. But then heart transplantation within it is even smaller, and pediatric heart transplantation is an even smaller group.
Yes.
And so investment and research can be quite challenging. Our founder, Lisa Anderson, she's always been passionate about it, made sure our products can fit the smallest of hearts. And
Yes.
her Guardian research does include pediatrics, and it's so clear when we look at the data. It takes collaboration, it takes broad scale research because the numbers are so small, and the pediatric population like that we look at sort of that adult congenital and that transition. It's also so varied. It's much more heterogeneous than the adult population. So not only do you have these small numbers, but it's very complex. And so
Super complex.
how
Yes.
yeah how do you uh, with so many priorities and so many needs, how have you been able to really address those and prioritize those? It must be a real challenge sometimes when there's so much good work to be done.
There is, and I like to look at it like this. You just hit the nail on the head. I mean, it's a very small niche area. However, the research and the innovations and technologies that come from this research have so many other applications, and they directly transition to the adult population. It's one of the reasons that we, I don't want to say get irritated, but we do get irritated in this field because the majority of the big money goes to adult research. However, everything that's discovered for pediatrics translates directly to adult. It does not go in the opposite direction, however. So, adult research does not, because of what you mentioned earlier, the complexity of a heart transplant for a child or a young person, typically under the age of 10, 12 years old, their body is still going through a tremendous amount of change, whereas an adult body is not. And so these bring on tremendous complexities that are not experienced in an adult organ transplant. And so, I often wonder, like, why is all the money going to the adult research? If we put it all into pediatrics, we would benefit both populations. But that's, there are lots of reasons why that is, but it's another, reason and priority for us because what we do is so critical, since the large dollars are not going into the pediatric research.
Absolutely. And I think one of the things I find working with pediatric heart transplant, I mean, all of transplant, being a small space, is collaborative, but um,
Yes.
the people I find, the clinicians involved with pediatric heart transplantation are particularly focused on this collaborative, partly because of the nature of the space, and I truly enjoy the network and team environment. And so I think what you're doing here to bring this group together and give them the tools they need to move it forward is really critical.
Yes, and I, I don't want to redirect us, but I'm very you just mentioned the word collaboration, and I'm a huge collaborator personally. I'm so excited that we have just announced at ISHLT just a few days ago that we will have the world's first Pediatric Heart Transplant Alliance. And this is a really big deal. We are bringing together six of the top organizations in this field together. We have already partnered for many, many years as one-offs, with one or two partners coming together for certain initiatives. And so for me, when I came on as CEO a year and a half ago, I thought, well, why don't we formalize this and really shine a spotlight on this niche area of need. And so we're super excited that that was announced and it is official. And so it's going to be exciting to see what we can do together
Mhm.
as six very strong brands uniting under the Pediatric Heart Transplant Alliance.
It's such an exciting announcement and such an important initiative for the space. And can I ask you? I'm always interested in sort of leadership and change, bringing this about and making an impact, bringing different groups together. How has that been? How has the process to get to this point been to get to this point of this alliance announcement?
Yeah, well, I've done this before on a global scale, but you never know. I mean, some organizations are very protective of their brands and they are not as open to collaboration. Just because I'm a collaborator and we want Enduring Hearts to be a collaborator does not mean everyone else shares that same perspective. And so I basically approached each of the partners that we had been working with at some level over the years, brought them all together for a preliminary discussion and said, here's where I'm thinking we should go, and I would love to get your reactions if you feel like this is warranted, and do you feel like your organization would be open. And I was shocked to find out that every single organization said absolutely. We didn't even know what it would look like, but they were all on board. And I'm sure people have thought about it over the years and just not taken action on it. And so this was an opportunity for us to make it happen. And so originally it was sort of funny because I'm a fast mover. And sometimes for me, timelines, I'm like, oh, we can do that in 3 months. And other people are scratching their heads going, oh, no, no, we can't move that fast. So that was the case with this particular initiative. And I was very pleased to announce that we went through it and structured the entire organization in less than 3 months. And they all thought we would take the better part of a year. So it went very smoothly because we're all aligned ultimately, even though each organization does something very different within the field. We're all bringing a critical element to the pediatric heart transplant space. And so there's no competition. We're all in this for the ultimate outcomes for the children.
Well, that's fantastic because it's a truly passionate space, and there's so much valuable research going on. Can you tell us a little bit about some of the research studies that Enduring Hearts is currently working on, or is working on in the near future?
Yeah, absolutely. I mean, right now, as of today, we have just it's always changing because we start one new one and we wrap up another one. Most of the research studies are 2 to 3 years
Hmm.
um, long, and so we have them constantly cycling through. But right now, we have active with Baylor, Harvard, Vanderbilt, Stanford, Columbia, Washington University in St. Louis, Emory, Cleveland Clinic, list goes on and on. These are extraordinary institutions, and we're privileged to be partnered with them. Some of the studies are without getting into the medical jargon, are focused solely on organ rejection and minimizing that. A lot of people may not know, but just 10 plus years ago, the average lifespan of a child with a pediatric heart transplant was, less than 15 years. Today, that number has changed to 20. And so that means a lot of people are living a lot longer, and some are still struggling to make it to the average. But that's a tremendous advancement in a very short period of time. So the rejection is still top of the list for investigators, and then the other part is improving the quality of life for the donor hearts. Because if we have a healthy donor heart, and we can treat that organ ahead of time before the transplant, then we are also minimizing rejection. And then there are other studies related to single cell RNA sequencing, and just basically improving the overall health of the child once they have their transplant. I just had the opportunity to listen to one of the investigators um, to give us his progress report on just physical activity and creating a physical activity program with each of these kids after their transplant, because physical activity is really really important for these children. So they're not delicate flowers. As I mentioned earlier, the donor's daughter is a cross country runner. A lot of these kids are very physically active. So helping them to figure out what that physical activity that benefits them the most is. So there's studies that really cross the gamut of topics, but they're all around ultimately increasing the longevity and the quality of life.
Oh, fantastic. And if a clinician, a surgeon, a medical physician is interested in getting more involved with Enduring Hearts research, how should they go about that?
Yeah, just go to enduringhearts.org. You'll see there's an entire portion of the site dedicated to the science and the research. We have letters of intents that we open up timelines. We have one coming up, I believe, the beginning of June. So you submit a letter of intent first. And then once the deadline closes for letter of intents, all of those letters go to the Scientific Advisory Council. They will review them and the merits, and make sure that all the I's are dotted, T's are crossed, and that your budget it looks good.
Mhm.
And then they will make selections based on how many we're funding that year.
Oh, excellent, excellent. And
Mhm.
research is not all that Enduring Hearts does. You also do a lot in terms of family support and transplant journey resources. Can you tell us a little bit about some of the non-research initiatives that Enduring Hearts is involved with?
Absolutely. So our programs are not our number one priority because we are a research organization, but we do have family support programs. We're proud to fund the Caregiver Connect program, which is more of a support program for families who are going through this journey of transplantation. We are partnered with Transplant Families to provide that service. And then we have two programs currently that are transitioning into a bigger program this year. One is Feed the Heart and Road to Recovery. So those have been um, gas card and food cards for families to help them through the financial challenges. I don't know that everyone understands, but a transplant in general, just the medical part of the transplant itself costs $1 million+ so if you are, not well insured, if you do not have the financial capability to not just during, that's just part of it. It's the waiting period before. A lot of these children have to stay in the hospital awaiting their transplant. One child just got hers last week, and she's been in the hospital for months waiting for her transplant. So then afterwards, it's all the trips to the doctor, all the checkups, all the medications, everything. It really is a financial strain on families. So we just try to help them out a little bit with the gas card, food card. But this year, we are shifting after the summer into another program, which we're very excited about, that will have even more impact on families who are truly financially struggling. It's going to be more of a scholarship program. So we will lean in heavily on the social workers who work at the transplant centers across the country to identify families, because we don't work directly with the family unless they reach out to us, but the social workers all know which families are truly struggling the most, and so we will lean on them to nominate families who truly need the most significant amount of financial assistance, and then we will be able to give larger funding support to those families that's unrestricted. So we're looking forward to that because we feel like that's going to have even greater impact on the family than just the few $100s that we give, in the food and the gas support.
Any chronic illness, and especially pediatric, on the parents and caregivers. It can be such a burden. Heart
Yes.
transplant, especially because, like you said, it's not just a single day in operation. This is something likely that the family's been struggling with for months, and if not years. And then the post care is not small. It's all of the
No.
follow up visits and management of immunosuppression is super complex, as has a lot of demands on the family and time away from work, things like that. So, wonderful work that you're doing in making sure that this therapy is accessible, and ensures that patients who need it can get it. So, truly appreciate that. To fund all of this kind of work certainly takes a lot of effort. You've had some really interesting fundraising initiatives, and you have some coming up. Can you tell us a little about some of your major fundraising initiatives and how people could get
Yes,
involved?
of course. Yeah, when I first came, I have to tell you, I looked at our signature event, which is an incredible event, but I thought, okay, pediatrics and bourbon. Not, I would have probably pushed back on that had I been here in the early days. But basically, our bourbon gala, we're headquartered in Atlanta, even though we work across the country and
Mhm.
even internationally. So when this challenge came upon our founder and his family, a lot of his good friends from college that were really close to them came together. A lot of them were bourbon connoisseurs long before bourbon became the thing. I mean, now bourbon tastings are everywhere, but 12 years ago, that was not the case. And so they all came together and wanted to support this organization that was newly founded. And so they created the first ever bourbon gala. 10 years later, we just celebrated our 10th anniversary in February. And this event has become, the event to attend. People fly in from all over the country to be at the event. We had like 14 different bourbons on our tasting menu this year. It was incredible. And so I've had to learn a lot about bourbon. But what that's done is also created these relationships with a lot of the bourbon distributors and different folks. So we sort of played into that because it was a distinguishing event in Atlanta, where we're headquartered, and all of the other major markets where we do events. It's very competitive. There's lots of great charities doing great work. And so you always are looking for something that distinguishes your event from everyone else's. And the bourbon tasting has done that for Enduring Hearts. And so we have bring together about 400 people every year, have a tremendous event, and raise anywhere from 600,000 to $1 million, depending on the year. And so that continues to be our signature event. But now we have spin-off events from that one, and we've taken those to New York City. We'll be back again in New York City at the end of the year. But we also have one coming up in Birmingham, Alabama. It's called A Rare Taste of Bourbon and Art. So we bring art together with a bourbon tasting. So we'll be at the Birmingham City Club on August the 22nd with that event. And then we have We have our bourbon and barbecue event, which is brand new. Legends Distillery will be hosting us just north of Atlanta for that event on May the 4th. And then we have our first ever all ladies event. So we're moving away a little bit from the bourbon and doing a champagne event and very high end, rare, one of a kind estate jewelry auction. And so we'll be able to have ladies participate across the country in this auction. And then it will all culminate into a 1 day event on June the 28th down in Buckhead, which is a prime area in Atlanta. And so we're very excited about that event. And then, of course, the New York event will be in October, probably middle of October. And we're hoping once again to have that on the rooftop of Salesforce Tower, which is right next to Bryant Park, and absolutely incredible views. You look out the window and you're looking at the top of the Chrysler Building and the Empire State Building. So we always pick wonderful venues and just have a really good time, but it's all for the kids and the mission. And so, it's a fun time, but it has a purpose, a very serious purpose.
That is absolutely wonderful. So, how can people get involved with this mission, this purpose? It's one of the things I love about transplant is how mission driven everyone is in this space. If anyone wants to get more involved with supporting Enduring Hearts, what are the best ways to learn more about these events and follow up?
Absolutely. Well, our website always has the events. We also put out a monthly newsletter. So if you go to our website, at enduringhearts.org, you can sign up for our newsletter as well. And I'm more than happy for people to contact me directly, and I will put you in touch with the right person on my team, L. Smith at enduringhearts.org. We're always looking for volunteers in all the major markets where we do events, just getting the word out. We are a very lean organization. We put as much money as possible directly into the research and the programs. So we don't have a huge staff. So we're very dependent on our volunteers and our committees who help us with these events in the various markets. And if you'd like to do an event in your market, we'd love to talk about what that would look like. We have lots of options that we can talk about, that can be scaled in various size markets. So just reach out to us. We'll be happy to respond and just explore any opportunity that you might have.
Truly, again, I appreciate it because pediatric research is it's close to my heart, and I think our whole company we really truly believe in it, and I think it's a space. There's so much advancement that's gone on, like you said, in the past decade. So many brilliant scientists who have advanced the research. I oftentimes the work that we're doing, I feel like we're standing on the shoulders of giants, but there's still so much work to be done, and so much more to improve the lives of pediatric patients and really focus on this underserved community. So thank you for everything you're doing. I think
Thank you.
especially right now in ensuring that the continuity of research funding is more critical than ever, and especially for pediatrics. So
Yep.
thank you for joining us, and thank you for everything you do.
Thank you for allowing me the opportunity. I agree with everything that you've said, and I think the future is bright. I mean, when you look at the last 10 years and what we've accomplished in such a short period of time, um, I think the next 10 are going to just be, mind boggling at what we might accomplish and the breakthroughs that are going to come. So, thank you for helping us share the word. We appreciate it, and we appreciate everything that you do.
Absolutely, absolutely. Thank you so much, and thank you everyone for joining.